The topic I'm going to talk about is to see whether we have evidence of the effectiveness of treatments against osteoporosis in the specific situation of patients at imminent risk of fractures. So to start with, we can define three different situations. Patient that just had a first fracture, and we know that they will have very high risk of having a new fracture in the 2 years following the first event. The second situation is patient at a high risk of falls. And the third situation is patient that indeed have a very high risk of fracture. So because of that, the risk of the further fracture is considered to be imminent. So in the first situation, there are actually only two trials that evaluated this situation. The first one was abaloparatide, but with a time frame that was quite large, 5 years between the first fracture and the inclusion in the study. And the second one was the Horizon recurrent trial evaluating zoledronic acid in patients that had a hip fracture. And in this trial, they had to be included within 90 days following surgery of this hip fracture. In both trials, the effectiveness of the drug was demonstrated, but I have to say that, for example, in the abaloparatide, the risk of fracture was quite low compared to a trial that was performed 15 years ago, like the teriparatide trial, for example. So this item of 5 years was probably not stringent enough to select a patient at imminent risk of fracture. Second situation, falls. There is only one trial evaluating the effectiveness of risedronate in decreasing the risk of hip fracture. And in this trial, in patients that were only selected on risk of falls, the drug was not effective in reducing the risk of hip fracture, while in the other subgroup of the study where patients were included based on skeletal risk of fracture, namely low BMD or prior vertebral fractures, the drug was indeed effective in reducing the risk of hip fracture. And then the third situation is the most common situation in clinical trial, is to try to include patients at high risk of fracture. But because it is always difficult to find a very specific group, most of the investigators actually conducted subgroup analysis. And in this subgroup analysis, they usually demonstrate that the drug is at least as effective in this subgroup with high risk of fracture compared to the overall population. But having said that, you have to keep in mind that in most studies, the interaction tests of this subgroup analysis were not significant. So there is still a lot of statistical uncertainties in demonstrating the effectiveness of drugs in this specific situation of an imminent risk of fracture. And we definitely need a new trial with this kind of population.